Thyroid cancers are becoming more common now. We do not really know the reason why that is so. It is commonly seen in people who are exposed to radioactivity. But then most of patients are not exposed to radioactivity. So we do not know the real reason why thyroid cancers are becoming more common. What is interesting about thyroid cancers is that it's much more common among the females rather than the males. Not all thyroid cancers are the same. There are four main types of thyroid cancers. The first is thyroid papillary cancer, which is about 70% of all thyroid cancers. Follicular cancers are 20% of the cancers, and then 5% for anaplastic cancers, and then 5% for medullary cancers. The outlook for thyroid cancer is very dependent on which of the four types you have. Thyroid papillary cancers are the least malignant of all the thyroid cancers. And by and far and large, the people who get it, the survival rate is 99%. For anaplastic cancer, which is 5% of thyroid cancers, these tend to occur in the older age people. Also, they tend to occur in people who have had either thyroid papillary or follicular cancers, but if not properly treated, they can transform into anaplastic cancers. These anaplastic cancers, the survival rate is almost 0% after 1 year. So it is very important, therefore, whenever you have a thyroid nodule, to have it properly assessed by a doctor. When we see a thyroid nodule, especially any nodule more than 1 cm in size, we will do two things for the patient. The first is we will send the patient for an ultrasound, and with the thyroid ultrasound, we will be able to suspect whether that particular nodule is a suspicious nodule or whether it's an innocent nodule. The second thing that we would do for the nodule is that either under ultrasound or directly, we will do a fine needle aspirate of the nodule. A fine needle aspirate is sticking a needle through the skin into the nodule to get out some cells, and this will allow the pathologist to be able to diagnose the particular nodule as to whether it is a cancerous nodule or not. Any nodule which is suspicious of being a cancer, and if the nodule is more than 1 cm, they should be surgically treated. Most of patients with thyroid cancers will need to have a total thyroidectomy done. This means that the whole thyroid gland will be removed. However, in the younger patients, that is patients less than 45 years of age, and with a nodule that is less than 4 cm in size, sometimes we will only take out the nodule and the lobe in which the nodule is situated. In other words, taking out half the thyroid gland rather than the whole thyroid gland. In the patients who have had the whole thyroid gland removed because it's a cancer, very often we will need to add radioactive iodine to help clear away the little tumors that may have gone to other parts of the body, but yet not noticeable yet clinically or radiologically. This is known as radioactive iodine ablation. Surgery is not indicated if the thyroid tumor is less than 1 cm in size, because in a significant number of such patients, even though the needle test has proven this to be cancer, if it's less than 1 cm, maybe more than half of them don't grow any bigger, and they do not transform into aggressive form of cancers. Therefore, a large school of surgeons will advise that anything less than 1 cm, you do not need an operation. Anything bigger than 1 cm, based on the ultrasound measurement, should have surgical treatment for the thyroid cancer.